This episode's brought to you by Heidi. Imagine kicking back while a HIPAA-compliant AI scribe juggles your notes, ICD-10 codes, letters, billing, and all that jazz for free. Yeah, you heard us right. On the house, it's free. From the genius brain of Dr. Tom, who hated wasting his life writing notes, he started Heidi to change the game. Your Heidi transforms consult babble into crisp, clear soap notes, personalizing itself with every edit you make. It's the next best thing to cloning yourself without the weird science behind it. One day, your Heidi will look through research, take calls, and do anything you don't want to. So what's the catch? There's no catch. If you currently pay for an AI scribe in your practice, you should swap to Heidi. They'll even credit you for anything you've already paid. Heidi will save you an hour or more a day without dipping into your wallet. Dive into the description for the link and make your practice the envy of every stethoscope in town. Sign up, lean back, and watch Heidi work its magic. All for free because you've got better things to do.
We work hard as physicians to take care of the health and well-being of our patients. But when it comes to our money, do we have the same condition of care? Probably not. Let's change that together. Welcome to the Financial Freedom for Physicians podcast, where we'll fight and advocate for your financial literacy. As always, I'm your host, Dr. Christopher Liu. Thanks for being here. Let's jump into the show. Hey guys, welcome to this week's podcast episode. I'm really excited about today's guest, Deborah Crowe. That goes by Deb, and she's actually the host of Imperfect, the Heart-Centered Leadership podcast. And today's talk is going to be all about leadership, heart-centered leadership, and it's overall business podcast. And I'm really happy to welcome her to the show. So Deborah, welcome.
Thank you so much, Christopher. It's great to be with you.
Yeah, kind of set the stage and talk about your story and your journey, how you got started, and we'll delve right into it.
Well, my background is in medical rehabilitation, and I worked as a neurotrauma case manager for over 20 years. And I had a twist of fate, if you will, 15 years ago. I was enjoying working with both children and adults who had sustained some form of neurotrauma. And I was spending a lot of time testifying in court, and I was missing the direct patient care. And out of the blue, I got a call from an adjudicator who asked me if I would take on 5 executives. There were 3 VPs and 2 CEOs who had gone off on a short-term disability claim from their leadership role due to stress. And it was a welcomed addition to my caseload and a reprieve from the heaviness of the catastrophic files I had and going to court. So long story short, from the day of that phone call, Christopher, to 10 months later, I landed up losing all 5 of those executives. They all went to long-term disability claims, became palliative, and landed up in our local hospice. And I had the honor and privilege of being with them at the end of life. And I promised them that I was going to do something about this going forward. And I took a year to grieve and close my clinic and do all the logistical exit strategy things you do in business. And my coach said to me at the time, "What are you going to do with this gift?" And I sat with that question. And 15 months later, I became a coach, and I work with all levels of leadership to ensure that they don't get to that level of stress. And I haven't lost anybody in that time frame, which I'm super happy to share with you.
Yeah, what a very inspiring and heartfelt journey. And I'm curious, I was wondering this idea of when you talk about heart-centered leadership, and people talk about heart-centered a lot of times, you can kind of feel it, but what specific traits make one a heart-centered leader?
Well, I created a heart-centered leadership quality sketch note in January 2020 that I would love to share with you and your listeners. It's now in 25 languages, and it's been downloaded over 90,000 times. And the 20 traits, just to give you an example of a few, they are from my experience. They are not an exhaustive list, but they're the 20 most popular that I witnessed in my practice when I was both case managing and when I transitioned into coaching. So Qualities like being an attentive listener, being an avid reader, being a lifelong learner, being approachable. Those are just a few to share from the list of 20. And my definition of heart-centered leadership is honoring your connection with people. And what that means is you're holding space, just like you and I are doing. We're living in the moment right now, having this beautiful interview. We're not thinking about this morning, the next hour after the interview, or tomorrow. And there's no level of reciprocity. We're just having a meaningful, aligned conversation and enjoying the value of whatever we're going to talk about.
I love that description. And I love this idea of in the moment and, whatever's going on around us, we can always focus and just kind of collaborate, share, and create something wonderful. The next question is, with heart-centered leadership and workplace, a lot of people feel excluded and, feel like it's not very representative. How do you make a workplace more inclusive?
Well, that's a big question to unpack. And I think you can't make any workplace or organization inclusive until you address the underlying problem that's lingering or deflate the elephant in the room. Usually when there's a problem of inclusivity, you have to look back to the foundation of the culture. And if you don't have a strong, healthy, vital culture, how can you even start to adapt to even integrate or change or welcome any inclusivity when we don't have the strength of the foundation, which is trust, rapport, openness, healthy, vital, not any remnants of toxicity. I think a lot of times people want to work on the top layers, and a lot of times it's returning to the foundation of the organization.
I love how you're describing these concepts, because they're, sometimes you can ask these questions and people can describe it, but the way you describe it can either really enlighten or kind of confuse more. So I love that. The follow-up question I have is, so you transition from disability medical case management, and now you're an executive coach. And for a lot of the audience, they're doctors or lawyers or dentists, and they say it's time for a change, and they say, oh, but all I've known is XYZ, and my skills. So what transferable skills did you bring from the medical to now being executive coach?
Oh, this is a great question, Christopher. So your audience is 65% of my practice. So many transferable skills. And it's going back to just a simplistic level of common sense. Think about all the things that you love doing within your medical career, whether you are a certified health exec, whether you're a physician, a surgeon, it doesn't matter. All of the skills go all the way back to the day you were born. And I do a really fun exercise with all of my medical professionals. And we look at all of the life skills that we picked up along the way, good, bad, or indifferent, our first exposure to kindergarten, our first volunteer, our first job, our first failure, our first barrier, a teacher who left such a beautiful imprint on our heart, et cetera, all the way up to the finishing of that medical degree, residency, and then where they went with their career exploration after that. There's a pattern and a trend, and all of those skills are what are your transferable skills, and they have influence from your parents, your grandparents, your upbringing, your community. There's so many different resources from family to academic, etc. And when we can go through this life exercise, it's how I show these physicians how they've mastered the art of heart in their life and leadership, but more importantly, Christopher, why they're the leader that they are today. And when we unpack this and they see the amount of transferable skills, it's just unwavering. It's, not to be cliche, but it's like an aha moment. So I bring communication, I bring openness, I bring heart-centeredness. The case manager shows up a lot of times because sometimes I get executives from multiple sectors on the brink of pre-health. So they have a chance before those executives that I lost. And to me, our life shows up in our work and our work shows up in our life. And the sweet spot is finding that beautiful space of work-life integration.
So wonderfully said. And, Yes, then the kind of the next question is when you're talking about, transferable skills, and especially in today's time, I'm reading more and more in the headlines, especially before you never heard about executives getting laid off, or, usually an executive's career was usually quite long, but now it's, shortening. So with AI, with technology disruption, remote work from home, people starting their own companies, what makes a good leader, and what makes somebody want to go and work for that leader as opposed to doing their own thing or starting their own business?
Great question. A good leader leads people. A good leader is visionary. They're able to look out and they can keep the extrinsic values of profit and metrics and margins and KPIs and all of those processes that are important, but they know deep down from a heart-centered modality that none of that will be carried out or successful or sustained unless they invert the fraction and put people over profit. So when people are put before profit and they can lead with that vulnerability and authenticity and model self-care and fail forward and all the things under the imperfection umbrella, that's a heart-centered leader. And who wouldn't want to follow someone that is genuine, unique, approachable, open door policy, and you can come to them and not have everything figured out and seek their guidance without worrying about reciprocity on your next annual review. That's who people want to work for today.
Yeah, I love that. The next question is, when talk about your experience and perspective for heart-centered leadership at the executive and C-suite level, and how can someone become a heart-centered leader at that level?
That's a tough one. It's a good one. I'm going to say right now, there's more at that level that are not heart-centered. And again, to defend them, what was modeled to them, what I like to call episodic leadership, was not heart-centered, because I was told for over 30 years there was no place for heart-centered leadership in business acumen. Yet, if you look at the components of business acumen, it's knowledge, skills, and abilities. To be a compassionate leader, a heart-centered leader, what do you need? Knowledge, skills, and ability. So I'm trying to bridge that gap, Christopher. The people that aren't, I have moved almost 98 executives at that level since May of 2020, because I think COVID gave us a big pause to reflect, have some solace time, and really brought for all of us, I'm going to say, an emergence of what's important in our lives, collectively, personal life, and what we do professionally. And a lot of leaders moved industries, they took demotions, and they wanted to get back to that level of happiness that they lost climbing that proverbial white ladder of success to hit the glass ceiling, which is completely an unrealistic expectation. So the ones that are doing it well, they don't talk a lot. They listen. They listen to their people. They mentor their people. They foster all the qualities within heart-centered leadership. They can be assertive, meaning, they have to be firm and friendly, look at other people's perspectives, sit in the observer's chair. When they do that, then their transformational leadership unveils beautifully, because people want to follow someone who's successful and visionary and heart-centered.
Really eloquently said again. And my follow-up question is, once we can elucidate these qualities and, talk about leaders at that level, the next question is, because you talked about, leadership was kind of this sort of modeled after, certain archetypes, but now talk about embracing imperfection in leadership, and, in a world where we have to, have it all together, we got that Instagram moment. How do you help leaders embrace their imperfections as strengths, and the role that vulnerability plays in effective leadership?
None of us are perfect. I mean, there's so many leaders in multiple sectors, and it's a daily conversation for me. And it goes back to that, reviewing your life. Where in your life lineage did you learn or hone or were told that you had to sustain perfection? it's an intergenerational trauma for most professionals. Based on my experience, it hits around age 40 when they want to get off the hamster wheel. They are beyond burnout, whatever that word is. We are yet to create it, and they have nothing left for anyone, including themselves. That's not a fun place to be. I would rather be imperfect and communicative and heart-centered and say, you know, Christopher, I wasn't fully present when you asked me to do that task. And I'm going to ask if you would be so open to, review it with me. And I don't think I fully understand your vision. Who wouldn't want to help someone? It's all about having meaningful, honest, vulnerable conversations. And if we look at it in the medical world, not everyone that comes into Emerge is a clean-cut case. So it's using those analytical, critical skills that they are taught. And physicians are taught equanimity, especially surgeons in medical school. So when you can align equanimity, that mental calmness and composure, with your heart-centered leadership skills, you're unstoppable from a heart-centered leadership perspective, because you are physically there for that person and you listen so deeply and intently that you can hear the emotion behind the words. That is a well-honed skill.
Yeah. And, finally, as we come to the ending of our talk, which I really enjoyed, is this idea where, all of us are career-driven, success-driven, we want to, strive for significance, but we also have a balancing act. So with your extensive experience, how do you guide professionals in achieving balance between career aspirations and a personal life, and offer insights into how leaders can maintain resilience and self-care, amidst their demanding roles?
I love this question. It's really simple. We are not what we choose to do in our business or our career profession. So I'll challenge your listeners to do some inner work and realize that their self-worth and their worth and worthiness is not attached to their identity, their role, their stature, their title, their role and responsibility from the HR department. We have different aspects in our life and our leadership for a reason, and we're not meant to let one take over the other. And that's where we get illness and sickness and breakdown of relationships, etc. So it's finding a unique balance so that you're happy and that you're living in a self-directed way and not in a heaviness of obligation because of the career that you chose.
How can people find out about the work that you do, check you out your social media and possibly work with you?
My website is debcrowe.com, and I also just wrote a book, and it's called The Heart-Centered Leadership Playbook, and it was released on November 1st. And we've been in the top 3 and hit number 1 about 5 times since November 1st in healthcare administration, which is just a serendipitous moment, Christopher. Even though I've left the medical world, I don't think it's really let go of me, but all the information is on my website.
And for all the audience out there, let's thank Deb for coming on. Very eloquent. I love this heartfelt, centered talk. You can feel it through and be sure to follow all of Deb's resources. They'll be in the links in the show notes. Give her a like and follow. Check out her book. It's on Amazon. I'm going to check it out as well. And with that, thanks so much for coming on. Thanks again to Heidi. Elevate your practice with a free AI scribe, zero cost, HIPAA compliant, and ever learning. Heidi turns tedious tasks into time saved. Ready to swap? We've got you covered for past AI scribe expenses. Head to HeidiHealth.com, get started, and make your practice the envy of every stethoscope in town.
I'm excited that you made it for another episode. You are truly the best. If you've been following the show for a while, you know that my passion is to bring you the education you need to find your path to financial freedom. Please come back week after week for new content, new resources, and great guests. Until then, if you haven't already, please be sure to check out the website, www.drchrislumd.com. phd.com for more support. I'll see you next week.